All right. Hi, everyone. Thanks again for joining us today on our webinar today for Simplify Appointment Management for you and your patients. As you already know, this conference is muted today. If you have any questions throughout the conference, please feel free to ask them in the Q&A section on the bottom right side of the screen, and we'll do our best to get to as many as possible. My name is Yvonne Ramya from TELUS Health. I'm very excited today to introduce our partner, Chronometriq. Familiar with Chronometriq, they are an end-to-end solution for all your appointment needs. Think of online appointment booking, automated appointment reminders, and self-service check-in kiosk. I'd like to introduce Christelle Bone, the program manager at Chronometriq. Christelle, take it away.
Welcome, everyone, and thank you for attending our webinar. Christelle Bone, part manager at Chronometriq. I'm here today with our healthcare solution specialist, and we'll go through the presentation and answer your questions at the end. Quality is obviously not just the two of us. It's a team of dedicated developers, designers, marketing, sales, and operations specialists who embrace the mission to improve access to healthcare for all Canadians. In 2012, Chronometriq has developed application to improve doctor-patient communication. And recent partnership with TELUS, now coast to coast, from Finland to BC, and clinic managers are using Chronometriq digital technology to better manage healthcare. We truly believe that within 5 years, everyone will book their health appointment online. And it's not just us saying it. I've been to many conferences the past year and a half, and it made me realize that we're at the right time, at the place. Majority of clinics and doctors have adopted EMR, so that's behind us. The next step is to embrace the trend of empowering patients. Studies are showing that when it comes to managing their health, patients want to use technology, but some can. We found some statistics out of InfoWay reports. 71% of Canadian patients would like to book their appointment online. And that online booking is only beginning. That's why I was saying we think in 5 years from now, everyone will book their appointment online. We're on field, we're talking to you, we're talking to doctors and clinic managers like you, and we understand that managing a clinic can sometimes be hectic, and that you would like to keep control over your schedule and your costs. And we built our product with increasing productivity in mind while empowering patients. Another feedback we're getting from the field is you feel you don't have enough time in your day, your staff is exhausted, your phone lines are always busy, patients are complaining because the phone lines are busy or they wait too long in the waiting room, or else you have no-show problems, which reduce the access to healthcare. At Chronometriq, we offer an end-to-end solution for appointment management in the background for you. This is TELUS EMR and API. We have a seamless integration with your EMR. Technology then is not a burden nor something else to learn. It's helping you to free some time to take care of your patients and your staff. So Yvan was mentioning, under the theme of simplifying appointment management, I will show you how Chronometriq can help you increase productivity at your clinic while empowering patients. Our offers online booking, automated appointment reminders, and a self-check-in kiosk. We take care of your patient from the point to their arrival. I have a quick video to show you that gives you a great overview to start with.
Hey there. Welcome to a brief overview on how Chronometriq can simplify the interactions between clinics and patients. While improving their experience, it increases your operational efficiency. Online appointment booking, your patients have 24/7 access to healthcare, allowing them to book, cancel, and manage their appointments in a simple way. You have options to book your appointment. You either go to your clinic's website, on which you'll find a link to book online, or you can go to chronometriq.ca, search for your clinic, which will then take you to the portal. From there, patients can book an appointment in just 4 easy steps by entering their health insurance number, verifying their data, setting the time and date of their appointment, confirming, and that's it. Then receive a confirmation email with all of the appointment details and an option to cancel if needed. For their appointment, they'll receive up to 3 automated appointment reminders with an option to cancel. These reminders have been shown to reduce absenteeism to less than 2% while freeing your staff so they can focus on priorities. It saves your staff and your patients needless time on the phone, resulting on a better healthcare experience for everyone. On the day of the appointment, patients can find medical self-service kiosk where they can check in by simply entering their health insurance number, alerting the clinic to their arrival automatically. In Ontario, it's a bit easier. They have to swipe their Medicare card, and it's done. Simple as that. Not only does this product allow the patient to log in seconds, waiting long lines, but it gives them the option to update their information, allowing your staff to be more productive. Empowering the patient to self-serve at the clinic even gives you the possibility to increase your number of health professionals. Online appointment booking, automated appointment reminders, and medical self-service kiosk are 3 ways you can improve the operational efficiency of your clinic while increasing healthcare access and the empowerment of your patients.
An overview. In a few minutes, we'll actually go into greater details. But this video was actually showing is also a matter of saving time. Our solution relieves your staff from a tedious, time-consuming tasks, so focus on more productive ones. A common concern of clinic managers that we've met in a few months ago is to find qualified staff. I don't know if it's something you encounter as well. Few clinics can afford to have dedicated resources to answer the phone. Most of the time, most of the clinics that we're visiting, the receptionist does it all. And checking patients, book next appointment with patients out of doctor office, calling patients to remind them of their next appointment. They are more over. Some governments are imposing extended hours of operation. All this could make it difficult to find qualified receptionists, and if it's not difficult for some of you to find them, it is at least as important to keep good ones when you find them. So our Chronosuite, our solution, are designed to save you time and focus on what are most for you. The other one piece of the equation is the seamless integration. And say seamless, we are truly and fully connected to your EMR. TELUS API, which is kind of a secure channel between us and your EMR instance, allows us to exchange information in real time with your EMR. All information we need is coming from your EMR. Does it mean? It means that your staff doesn't need training. They continue working with their EMR as usual and gather the information we need to make work. A client once said to me, we don't notice you, but it was in the background for us. It is one of the nicest compliments we have, given that the seamless integration is one of our main and core features. Our development team and design team are working hard to make our solution easy to use and flexible and fully integrated with EMR. Dive deeper in our solution. So online booking that we call Chronobooking. The patient-facing one. The first step when a patient wants to communicate with their doctor, most of the time they will think of booking an appointment with their doctor. By offering online booking, you're empowering your patients to book at their convenience. And with Chronobooking, it reduces the phone queues. So your clinic has innovative up to the doctor's schedule. But more importantly, your staff continues working in the EMR. How does it work? As you've seen in the video, there's two options, whether you have a website of your own, on which we would put a button saying book online, or if patients are coming to our new portal at chronometriq.com, they can find your clinic there and start the booking process from there. After it, it's really simple. There's no username, no password. You use the health card number as an identifier, and there's 4 easy steps. Identification. Patient can also update their demographic information and push back into your EMR in real time. Tell you why they would like to see the doctor. This is all customizable by you. So depending on your type of practice, it's really flexible and allows you to customize the reasons for a visit. Patient picks a date and time, and an email at the end confirming that they have booked an appointment. In this email, they can add the appointment into their personal calendar, and through there, they can also cancel the appointment.
Krista, I just wanted to mention that if there's anybody, other attendees that are having a problem to listen to the audio, please just dial the number that's on the Q&A on the right-hand side.
Hear me quickly. Who working during the rehearsal. There is another of our products that definitely help you be more productive. Most reminders or phone calls that receptionists are doing on spare time, and it's for them somewhat, or for clinic managers that we've met, sometimes difficult to have receptionists do this task. But it's really important because on average, 10% of Canadian patients are not showing up at their doctor's appointment. This is reducing a lot the access to healthcare for other people that might need it. So on top of reducing no-shows, it's also a reduced phone queues, and I'll show you in a second. The patient can actually cancel or confirm their appointment, so it gives great visibility over your schedule. So really easy to set up and flexible. You get up to 3 reminders, and you choose the numbers of days in advance you want us to send the reminders. This is done in your dashboard. I'll show it to you in a second as well. And we send reminders to all appointments, not only the ones booked online. You can send email, voice, or SMS. And you can customize the general message. This custom feature actually really going over and above my expectations. Not only you can customize the general message, and also create message to deliver specific instructions based on the appointment type. Receives the notification, they can confirm or cancel through the reminder, and the status of the appointment is changed to confirmed automatically in your EMR, and the canceled appointments are removed from the schedule to allow you to book another patient. Kiosk is our self-service check-in kiosk. Think of it as Nexus versus regular custom. The idea there is really to fast track the chin and relief pressure on the front desk. Most of the clinics coming to us about the kiosk are telling us that the receptionists are exhausted, that wish to increase the number of healthcare providers, or that some receptionists left either for retirement or left altogether, and so they're short-staffed. Hiring someone new is a lot of, let's say, expenses and management, when you can offload some of the tedious task of check-in to a kiosk. It is classic at reception and pressure on the reception desk. Some of the clinics I visited have monitored glass in front of the receptionist, so or signs saying that violence is not acceptable in those premises. For all of those reasons, if you can relieve that front desk people from getting harassed or from fear, the kiosk is there to help you. The turnkey solution, it's an iPad within the casing. Everything's included in our package. Again, within few seconds, it's simple and easy to check in. The patient shows to the kiosk. The one-step identification, again, with the health card. Interview, we have a swiper, patient their card. You can accept patient being late or not. It's really straightforward. So what we do at this point, we connect to your EMR and say, is this patient yours, and does he have an appointment today? And both answers are yes, they move to the next slide, or to the next screen, sorry, and they can update their demographic information. All demographic changes are reflected again in your EMR in real time. Remember the API connection we have with and our wish to be fully seamlessly integrated. Also, it also means that what we do is in real time and updated. And the patient status change to arrived in your EMR. And we added a new feature which is called Wayfinder, and you can tell the patient onto which waiting room to go at the end of that process. So with a few seconds, the patient is checked in, the nurse or the doctor knows that the patient arrived. It really simplifies the flow of the patient. So these are the three solutions within the Chrono suite. The one thing that is also really interesting is the dashboard. At the dashboard, you can manage all three solutions all together in one place. Configurations are similar from one product to the other, so you don't need to train your staff. We train one super user to do the configuration. And once it's configured, when it's set up, we background for you, and your staff continue working in the EMR, and it's business as usual. The application is also really easy. We harvest the data from your EMR, and so there's no double entry, there's no manual entry. We work with your data to do the setup. Also, one big advantage of having all three products end-to-end, one-stop shop, is you can leverage one solution to promote the other one. So, for example, you would like, you have online booking, but you would like to let your patients know that they can now book online. So you could send a link to the online booking portal and the email reminders, for example. When a patient receives their reminders for their appointment, you could say, like, you could book this appointment online, here's the link. Or if you have the kiosk reminder, you can customize the text to say, you mentioned at this date and time, to proceed to the check-in kiosk upon your arrival. There's a lot of synergy that can be done between the three solutions altogether. As much as I would like to be like Microsoft and selling you the Chrono suite altogether, I shall say that you can subscribe to each of them separately. Start with one, and then to activate the one, or if you need more information on the other one, it's as simple as clicking on product name in the dashboard. Benefit from the Chronometriq end-to-end solution, or being a client, is to also from Chronometriq.com portal. This is where into our portal they would go and seek for medical resources in their city. They would see a listing like that on a map of the nearest clinics around them, allowing new patients to find you even if you have the website. So this network is something that we're devoting a lot of effort on. We're advising patient consumers to our new Chronometriq.com portal, and we really want them to use it as a reference for healthcare resources. what clients say, those clients, there's only two, but most of the clients are choosing us because it's simple and easy to use. We offer flexibility in control. We're improving productivity overall. But we're a team of, as I said earlier at the really beginning, of dedicated people. Everyone at Chronometriq is oriented and really looks into continuously improve our solutions based on our clients' need and feedback. So Met is one of our first clients. Don is a more recent client in Calgary, but what all comes out of their testimonial is about simplicity, flexibility, and continuous improvement. Chronometriq solution will optimize the schedule, reduce show, empower your patient, and overall improve patient and staff satisfaction. We're an end-to-end solution. We're a one-stop shop, and we have a lot of experience. We have sales representatives on the field that can help you assess your needs. And if I may, when you're looking to an add-on services like us, you may want to build a little questionnaire, prepare some questions, and make sure that you're comparing apples to apples. Our team is there on the field. We have a lot of experience with this type of clinics, and it will be our pleasure to assist you in the next step to either build a questionnaire or answer your question. Speaking of questions, I think we're at I'll end the microphone to Oolong, who's been gathering all your questions on the Q&A bar. So it's about now.
Well, I tried to answer as many questions as I could on the text box. However, I do have some questions I haven't been able to answer. So Fran asked if we need to have another software to be able to do the reminders with the phone system in the office. The answer is you don't. Basically, what we do is we're integrated with your EMR, and we do reminders from our platform. So we can use your clinic's phone number when we call back patients. That way, patients know it's the clinic that's calling the reminder, or we can use another phone number if some clinics don't want us to use their phone number. So we're already integrated with your EMR. It's something that can be done very quickly. We also had other questions, notably one that someone asked if it was possible to subscribe to one of the solutions and not all of the three. It is possible. So we do have the most comprehensive offer of solutions for the online the appointment ecosystem, if you can call that. So the reminders, the booking, and kiosk. We do have some clinics who only opt for one or many of the solutions. So it is independent from one another. And once I just want to remind that the reminders, patients do not need to have booked an appointment online to receive a reminder. If the appointment exists in the EMR in your schedule, then we can definitely send a reminder to all of those patients. And I'm trying to the questions, see if there are other questions I haven't answered yet. I think it was a question on embedding the enroll into your clinic website. So I think Chriselle did mention that what we do recommend is that the booking portal usually is is another website. So either you can add a button, patients can click on that button and it'll send them to the booking portal. However, I think there are some clinics who are looking towards embedding the portal into their website with iframe. I believe it has not been done yet. However, we did ask our technical team, and there's no obstacle on our side, so it would be theoretically possible. Everyone, how our pricing structure works. So it's a per transactional pricing structure, meaning that for every appointment booked online, for every appointment reminded, and the reason why I'm saying appointment reminded is that we can send up to 3 reminders per appointment, and for every patient that checks in at the kiosk, it's about a quarter of a loonie. So if only 10 or 20 patients booking online that week, then you would only pay for those 10 appointments. There's no monthly cost per physician or a monthly subscription cost. It's per transactional, so you pay for exactly what you use, and there's never any overheads where if a month you don't use a system to pay. No, it's really you pay for what has been used. So again, I'm just trying to go through quickly the different so a lot of questions. Question on, I do see a question on possibility of patients having to select a reason. So yes, absolutely, patients do have to select a reason of visit so that we can allocate them the right amount of time and the right time slot for their needs. They do have to select a reason of visit. The description on the portal is 100% configurable by clinic, and we also have the option of adding a text box so that patients can write their symptoms. So often we do have some doctors who like to know why their patients are coming in. So by filling out that text box, doctors and healthcare professionals can prepare themselves in advance for their appointment. Another question is on if it's possible to only have the online booking or all 3 combined features. So absolutely, once again, it is possible to only subscribe to the online appointment booking. So every single one of our solutions is independent from another. So it's possible to opt only for the booking, or only for the reminder, or only for the kiosk, or any combination of the 3. Another question on the minimum number of doctors in the clinic that can participate. So there are no minimum number of doctors in the clinic that have to participate. Everything is configurable at a doctor level and at an appointment type level, meaning that if you have a clinic of 5 doctors and we have 1 doctor who wants to participate with online appointment booking, reminders, or the kiosk, it's possible to do so. So basically, you just turn off, you don't activate any of the other doctors, you activate 1 doctor and you select for his appointment type, so it's possible to only have a single doctor at the clinic participate. And that also gives you the opportunity to, if you want to do a gradual ramp up of the solution. So start with 1 doctor with only 1 appointment type, and every week add another doctor, another appointment type. You control how the system is used, so you really have the whole control on the system and on your schedule. I see a question on if reminders are sent only to for patients that have booked online or everyone in the EMR. So when send reminders, if the appointment exists in your EMR, we can send them a reminder. So patients do not need to have booked an appointment online. Even we have some clinics that only use the reminders solution, so they have no appointment booked online. Everything is booked manually through their EMR, and we are able to send all of their patients reminders. I'm just going to do. So again, I'm going to the questions that have been assigned. On the sorry about that. Hard time going through all the questions. We did. So I did a question on if we can do customizable reminders. It is possible. So reminders can be customized at a clinic-wide level, also at an appointment type level. So if ever you have receptionists right now, when MOAs, when they call back their patients and they give them specific instructions, we can give them also. So I can give an example of a specialist that asks patients to bring their medication list. So it's possible in those reminders to add an instruction, ask patients to bring their prescription list with them. Oh, okay, sorry. On voicemail, how our reminders work is that, for example, if you decide to send phone reminders, it's possible also to send SMS and email reminders. So if we send phone reminders, it's if our system is intelligent, it can detect voicemails. So as soon as our system detects a voicemail, we'll leave a voice message on their voicemail. So we do have the capability of detecting that there's a voicemail and leaving a voicemail reminder. The text box for the reason of visit. So once the patient has selected a reason of visit, they can you'll know, let's say that they selected annual physical, and then they can write in symptoms. So it's they have a lot of characters, but they can write in the symptoms, and it'll be located in the note of the appointment. So when you look at the schedule, you can quickly see what patients have written.
All right, a couple of the attendees dropping off, so we'll wrap up the webinar now. Thanks everyone for tuning in. Thank you, Christelle, for the presentation. Thank you, Hugh Long, for addressing all the questions. I do see a few more questions coming in, so we'll try our best to get to all the questions and somehow get you the answers. Just an FYI, the webinar today is recorded, so we will be sharing the recording to you guys that joined in. For those who had an issue accessing the audio in the beginning, the recording will be sent to you so you can actually reiterate and rewatch the webinar. Apart from that, if you have any other questions, if Crystal, you want to go to the slide right before this one, there is an email there. You can email us directly for any questions or concerns, or if you want us to have a quotation for the solution itself, I could definitely help you with that. Once again, my name is Yvonne Ramya with TELUS Health. Thank you very much today for joining into our webinar. Have a great day.
Thank you.
Thank you.